Did you know that men are 50% less likely to visit their doctor as compared to women? Hi viewers, and welcome back to Bestie. When it comes to health, men's issues stay suppressed or less spoken about. Many times they tend to ignore their problems and refuse to seek help. Men are more likely to skip checkups, daily medical assistance, and ignore symptoms. Although sometimes an itch is just an itch and a sore muscle is just a sore muscle. But when symptoms persist or you start to notice certain patterns, it can signal that something more serious is going on. And in today's video, we'll tell you symptoms in men that should not be ignored, from dizziness, excessive thirst, constant fatigue, skin changes to persistent cough, and more. Watch till the end to learn about all of them. Number 1. Shortness of breath. If you feel short of breath in your day-to-day routine, it's time. You should not take it lightly anymore, though issues and symptoms differ from one body to another. But certain signs like breathlessness and exertion need to be taken seriously. For instance, if you feel shortness of breath right after a light walk, then it could be a sign of coronary ischemia. This is a situation where there's a complete or partial blockage of an artery that carries blood to your heart. If you feel any of the symptoms like pressure and tightness in your chest, extreme shortness of breath and dizziness, then you should consult your doctor immediately. What activities make you fall short of breath? Are they vigorous or even the simple ones that can do it to you? Tell us quickly down in the comment section. Number 2. Bloody or black stools. Bowel movements usually differ in color due to the foods that you eat and medications, but you need to pay attention when the stool turns out to be pale, black, or bloody. This problem can be serious and may be a sign of bleeding in the upper digestive tract. On the other hand, if the stool is bloody or maroon, then it may indicate bleeding in the lower digestive tract. If you recently notice your stool is like this, it's time to take it seriously. This could be a sign of hemorrhoids, bleeding, or ulcers. And if you notice unusual changes in the color of your stool, contact your doctor right away. Number 3. Dizziness. Dizziness can cause you to feel lightheaded, become unsteady on your feet, or experience the sensation that the room is spinning around you. It occurs when there's not enough blood reaching the brain. This may result from a sudden drop in blood pressure or dehydration. Dizziness often accompanies health problems like the flu, allergies, or hypoglycemia. It could also indicate a serious health risk like heart disease, stroke, or shock. Number 4. Excessive snoring. Is your own snoring waking you or your partner up at night? That could be a sign of obstructed sleep apnea syndrome. This disease can wake the snorer and interrupt their breathing. It may lead to problems like daytime fatigue and greater risk of high blood pressure, irregular heartbeat, heart attack, and stroke. If sleeping on your side or stomach doesn't help, then it's time for an appointment with a sleep specialist who can make the appropriate diagnosis. Recommended treatments include a CPAP breathing device for continuous airway pressure and similar devices. Number 5. Frequent heartburn. Occasional heartburn isn't a crisis, but anyone having problems at least twice a week may have gastroesophageal reflux disease, or GERD. GERD can cause inflammation, bleeding, ulcers of the esophagus, and may lead to cancer and precancerous conditions. Lifestyle changes should reduce the instances of heartburn. Taking trans fats and oily food out of the diet can help, as can avoiding alcohol, processed meats, caffeinated beverages, and certain other foods. More severe cases need to be treated with medications. Number 6. Excessive thirst. Staying hydrated is good for you, but constant thirst may indicate a health problem. It's one symptom of diabetes, the metabolic disease in which raised blood sugar induces thirst, so you drink enough water to eliminate excessive glucose. Keep up with annual blood tests to assess glucose levels and monitor the potential insulin deficits of diabetes. If you have a family history of diabetes, you should have your blood sugar checked. Excessive thirst may also be a symptom of internal bleeding, infection, or organ failure. Number 7. Trouble with vision. Eyesight is often a casualty of advancing age. Regular eye checkups can catch more serious issues that might otherwise be hard to notice. Blind spots, blurry and tunnel vision, and halos on light can be symptoms of worrisome eye conditions. An exam to check eye pressure can help detect glaucoma or diagnose diseases like cataracts, diabetic retinopathy, and macular degeneration. Vision problems are also sometimes related to stroke or the growth of a brain tumor. And if the volume is way up on that TV, it could be a problem with hearing loss. That's something else you might want to have examined. Number 8. Frequent fatigue. A bad night's sleep or physical exertion can leave anyone exhausted, but fatigue for an extended period of time is a red flag worth a trip to the doctor. Prolonged tiredness can be a symptom of certain cancers and infections, kidney or liver disease, diabetes, and congestive heart failure. A sleep disorder is another possible trigger, as is a problem thyroid gland, anemia, and psychological conditions such as depression. When it seems no amount of coffee is enough to get ready for the day, it's likely time to see a physician. Number 9. Erectile dysfunction. Most men don't want to talk or even think about erectile dysfunction or ED, but it could be a red flag for a much more serious disease. If you're 45 to 50 and your only health issue is that it doesn't work in the bedroom the way it used to, that's a huge red flag. ED may signal a lack of blood flow, which indicates trouble in other parts of the body too, such as the heart and the brain. If you develop this problem, it's likely to predict a heart attack or stroke in the next 10 years as smoking or family history of heart disease. Number 10. Swollen or stiff joints. You might think experiencing stiff or swollen joints is due to all that extra yard work you did, but it can also be an indicator of bigger problems. One thing you should never ignore is joint swelling and joint stiffness. This may occur anywhere throughout the body, could be the hands and feet or knees. Oftentimes, it could be the start of benign degenerative arthritis or osteoarthritis, but may underlie something more serious or detrimental. It may be the early signs of autoimmune arthritis, immune system imbalance, hormonal imbalance, improper nutrition, or physical deconditioning. It's very important to have strong bones if you want to prevent diseases like arthritis. To know how you can strengthen them, watch this video titled 11 Ways for You to Build Healthier Bones. Now back to health symptoms that men should not ignore. Number 11. Skin changes. Check with your doctor if you find a new and oddly shaped freckle or mole. Also check if an existing mole changes in color and size or starts to bleed. These could all be signs of skin cancer. Men are constantly at risk for this disease. This is especially true if you're often outdoors and don't wear sunscreen. Waiting to have changes checked out by a doctor can be dangerous. Some forms of skin cancer are fatal. If found and treated early though, many times it can be cured. Number 12. Frequent urination. Frequent urination can be a sign of diabetes. It can cause you to urinate frequently because your kidneys have to work overtime to eliminate excess sugar from your bloodstream. Prostate problems can also cause frequent urination. Other symptoms of prostate problems include decreased flow while you're urinating, discomfort in the pelvic area, and blood in your urine or semen. Enlargement of the prostate is another common condition among older men. Although it's common, you shouldn't ignore the symptoms, as they can be identical to the symptoms of other more serious conditions. Number 13. Persistent cough. Most coughs will clear up within a week or so, but sometimes a chronic infection such as bronchitis may develop. However, persistent coughs may have a range of common causes from asthma to acid reflux, sinusitis, or side effects from medications such as ACE inhibitors, used to treat high blood pressure. See your doctor if you've had a cough for longer than 3 or 4 weeks. If you're a smoker, don't avoid seeing your doctor because you don't want to be told to stop. A smoker's cough can be a sign of COPD, a serious lung disease that will become extremely debilitating if untreated. Other serious causes include lung cancer, a blood clot on the lung, or heart problems. Number 14. Constipation. Occasional constipation is normal. Most people experience it from time to time, and it often becomes more common after age 50. But chronic constipation can be more troubling. It can lead you to push and strain when you're trying to have a bowel movement. This raises your chance of developing hemorrhoids, which can cause bleeding and discomfort around your rectum. Chronic constipation may also be a sign that something is stopping your stool from exiting properly. A tumor, polyp, or kink in your intestines may be blocking your colon. You may have an underlying condition that's causing abnormal colon motility. An early diagnosis is important so that you can rule out serious conditions, such as colon cancer. Do you ignore simple health symptoms? Or would you rather visit the doctor for even the smallest of things? Let us know in the comment section below. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.